how does patient data actually move between different healthcare systems, say from a lab instrument all the way to the provider screen, without losing accuracy?
Yeah, it's a fundamental question. And look, as someone who's been uh, navigating these complex systems for about 2 decades now, I really get the real world headaches this involves. That's actually why I'd suggest checking out Maria's data flow journey. It's a resource that it really walks you through it step by step. You can see how to design integration workflows that genuinely work in health IT projects. You'll find the link for details. Okay, so let's walk through how this actually happens day to day and critically what ensures the accuracy we need. In healthcare IT, the robust flow of data is pretty much enabled by interoperability standards. We still rely heavily on HL7 version 2, that's HL7, for a lot of the core messaging.
Right, like the classic ADT messages, admissions, discharges, transfers.
Exactly. That ADT message is a workhorse. And then there's FHIR, which is pronounced FHIR. That's more for the modern API-based exchanges.
API, so application programming interface, allowing systems to talk more directly.
Precisely. It's like a more modern universal language for these software applications to communicate securely. And these standards, HL7 and FHIR, they're absolutely critical. They ensure that things like lab results, imaging data, basic encounter information, they all keep their original meaning and structure as they move.
So they don't get jumbled up or misinterpreted.
Correct. And this consistency is vital as data travels between, say, an electronic health record or EHR system, then maybe over to billing systems or even out to public health databases.
Okay, so these standards, they kind of build the roads for the data. But once it's actually moving on those roads, what are the specific safeguards? The things that stop errors or prevent data from getting lost or garbled.
That's a great question because the standards are just the start. The safeguards are where the real precision work happens. Let's take an example. A blood sample gets drawn in the ER, so that data moves from the lab analyzer probably to the lab information system, often using an HL7 version 2 message, maybe an ORU R01 message type.
Yeah.
Now, one of the most important safeguards that kicks in right there is terminology mapping. Think of it like a universal medical dictionary.
Like a Rosetta Stone for health terms.
Kind of, yeah. So
Yeah.
LOINC, that's pronounced LOINC, is used specifically for lab results. It makes sure that, say, a cholesterol test result means the exact same thing clinically, whether it came from a small clinic's lab or a giant hospital system.
Got it. Standardizes the test itself.
Exactly. And similarly, you have SNOMED, pronounced SNOMED. That provides a standardized language for diagnoses. It ensures pneumonia means the same specific condition across different EHR systems. Without that mapping, one system's flu might be totally unrecognized by another.
Right, avoiding ambiguity.
Crucial. And then another absolutely essential safeguard is identity matching. This is all about preventing patient mix-ups.
Which sounds like it could be a huge problem.
Oh, it is. Making sure John Smith's lab results from the emergency room don't somehow end up attached to Jane Doe's record. It's especially tough with common names or maybe incomplete demographic information coming in. From my experience, the real challenge often lies in reconciling patient records that come from totally different, unconnected systems. Sometimes you need pretty sophisticated, probabilistic algorithms to figure out if two slightly different records actually belong to the same person.
Wow. Yeah.
And for me, here's kind of the turning point when it really clicked. Seeing how these standards like HL7 and FHIR and these safeguards like LOINC, SNOMED, and identity matching, they aren't just abstract technical rules. They are literally the backbone ensuring patient safety and making sure the care delivered is based on accurate information.
That really puts it into perspective. It's not just about the technical pipes connecting systems, but about this shared language and these really rigorous identity checks to make sure the right information gets to the right place for the right patient.
Exactly right. And, this naturally raises an important question for you listening in. How well are your own organization's current data flows actually aligning with these critical standards? Are you confident? And maybe more importantly, what hidden accuracy gaps might still exist in your systems that you haven't uncovered yet? Remember, as a health IT professional myself, I've spent 2 decades working through various roles, tackling these exact challenges, helping organizations optimize how their data moves. If you're looking to build that kind of authority and deep insight in your own career, maybe consider looking into one-on-one coaching options. It can really help accelerate your understanding and your impact in this absolutely vital field.